Good evening, sir.
Good evening, sir. Sir. Good evening, sir.
Madam, voice.
Good evening.
Net weak இருக்கா?
அந்த யூடியூப் லைவ் ஸ்ட்ரீமிங்கே லோடிங் காட்டுதுங்க.
ஓ இல்ல, அது ஃபர்ஸ்ட் லோடிங் தான் காமிக்கும்.
சார் உங்களோட பிரசன்டேஷன் என்கிட்ட ஜெயசூர்யா கிட்ட எல்லாம் பேக்கப் இருக்கு சார். அதனால ஏதாவது இஷ்யூஸ் இருந்ததுன்னா நாங்க பார்த்துக்கிறோம் சார்.
என்னோட பிரச்சனை
சாரோடது இல்ல, அது சூர்யாவோடது.
நாங்க நெக்ஸ்ட்
சார் அனுப்பல.
அப்போ அனுப்பிடுங்க. நல்ல வேலை
இருமா, கடைசி ஸ்லைடு போயிட்டு இருக்கு.
பிரசன்ட் பண்ணும்போது தான் எடிட் பண்றவங்க ஆள் இருக்கும்போது
ஆமா சீரியஸா என்ன சீரியஸா அந்த கோல்ட் மெடல் முடியல.
ரொம்ப அதிகமா தெரியுது. என்னோட பிரசன்டேஷன் நான் முடிக்காத முன்னாடி நீங்க முடிச்சிட்டீங்க.
இல்ல எனக்கு அப்பவே டவுட் அந்த பரவாயில்ல சார் 3 மணிக்கே முடிச்சிட்டாரு அப்படின்ட்டு. சரி பேக்கப்காக வந்து 2-3 பேர் கிட்ட அனுப்பியிருக்கீங்க அப்படின்ட்டு நினைச்சிட்டு இருக்கேன்.
சரி,
சூர்யா நேத்து அவன் இதோட தான் அனுப்பிச்சான்.
5 o'clock 4:45 நம்ம ஒரு கமர்ஷியல் பிரேக் கொடுக்கலாமா நம்ம செமினார் பத்தி பேசுறதுக்கு?
சரி சார்.
அப்ப யாராவது ஒரு சிக்னல் கொடுங்க. நான் எங்க ஓகே நான் பிபிடிலயே அதை இது பண்ணிக்கிறேன். ஓகே
பிபிடில பண்ண வேணாம் சார். நீங்க ஏதாவது ஒரு இது வரும்போது
ஒரு பிளாங்க் இது விட்டுறேன் அப்படின்னா பிரேக்னு.
சரி. என்ன ஸ்வேதா, லைவ் ஸ்ட்ரீமிங் ஓகேயா?
அதுல ஏதோ சவுண்ட் வந்துட்டு இருக்கு மேம். ஒரு 2 minutes மேம்.
அது ஏன் வருதுன்னா வேற வேற உங்க இது அன்மியூட்டா இருக்கும் போது அதுல நாய்ஸ் வரும். வேற வேற ரூம்ல உட்கார்ந்து
கிளினிக்கு வெளியே இருக்கேன்.
ஓகே ஓகே
மேம். ஓகே மேம்.
வந்திருக்க வைங்க.
இல்ல அது வந்துரும். வரலன்னா அடுத்த 2வது செகண்ட் வீட்டுக்கு வந்துருங்க. வீட்டுல இருக்கிற இன்டர்நெட் டாப் ஸ்பீடா இருக்கும்.
யூடியூப்ல வந்து ஒருத்தர் மானிட்டர், யூடியூப் லைவ் ஒருத்தர் மானிட்டர் பண்ணும். அங்க வந்து ஒரு மெசேஜ் போட்டு கொஸ்டின்ஸ் வேணும்னா அங்க கேட்கலான்னு அதுல போட்டுடலாம். சோ தட் கொஸ்டின்ஸ் கேட்டாங்கன்னா அவங்க அங்க சொல்றதுக்கு ஈஸியா இருக்கும்.
அது ஆல்ரெடி பிளான் பண்ணியாச்சுப்பா. ஸ்ரீரக்ஷாவும் ஸ்வேதாவும் பாப்பா.
எஸ் மேம். சார் ப்ராப்ளம்ஸ் சார். குட் ஈவினிங் சார்.
Good evening to all.
Good evening sir. Good evening sir.
Eagerly waiting.
Yes sir.
குட் ஈவினிங் சார். இருங்க சார், பிபிடி முடிஞ்சதுக்கு அப்புறம் சொல்லுவோம் சார்.
ஓகே பார்க்கறேன், செக் பண்றேன். நான் இதுக்கும் ஒரு வாட்டி ரெக்கார்ட் நானும் பண்ணிக்கிறேன் சேஃப்டி. ஆமாமா பண்ணிடுறேன்.
அது இந்த பெரிய பேம்ப்ளெட் வச்சிரலாமா மேம்? இல்லனா அந்த சின்னதா
நோட்டிஃபிகேஷன் வந்திருக்கு. இதே இருக்கட்டும். அது ஏதோ ஒரு பேம்ப்ளெட்.
ஓகே.
இதுல எல்லாரோட பேரு இது எல்லாமே இருக்குல்ல. இதே இருக்கு.
சரி
மேம் நான் பேசுறது கிளியரா கேக்குதா மேம்?
எஸ், லவுட் அண்ட் கிளியர்.
கிளியரா தான் இருக்கு.
ஓகே.
லைவ் ஸ்ட்ரீமிங் வந்துருச்சு அன்பு. எனக்கு நோட்டிஃபிகேஷனும் வந்துருச்சு. சூர்யா குரூப்ல லிங்க் ஷேர் பண்ணிருக்கேன் பாருங்க.
எஸ் மேம், எஸ் மேம். அது நான் ஷேர் பண்ணிட்டாங்க எல்லாருக்கும்.
சூப்பர் அன்பு, சூப்பர். நேத்து போட்டதுனால ஜூலை 4th வருதோ? பரவாயில்ல, ஒன்னும் ப்ராப்ளம் இல்ல. எதுவும் மாத்தாதீங்க, அப்படியே இருக்கட்டும். நோ ப்ராப்ளம்.
இல்ல கரெக்ட்டா தான்
இல்ல, நல்லா தெரியுது, நல்லா தெரியுது எனக்கு.
கிளியரா இருக்கு.
நான் யூடியூப்லயும் பாத்துட்டு இருக்கேன், கிளியரா தெரியுது. சூப்பர். அந்த சாரோடதையே ஃப்ரண்ட்ல வச்சு விட்டுருங்க. இல்ல, திக்வா மேம் ஜாயின் பண்ணிட்டாங்களா? இல்ல
5 minutesல ஸ்டார்ட் பண்ணலாமா மேம்?
ஆமாப்பா 32 இன்க்ரீஸ் ஆயிட்டே போயிட்டு இருக்கு. ஸ்டெபிலைஸ் ஆகட்டும் நம்பர்ஸ்.
ஓகே.
100 வந்துட்டோம். Good afternoon, ma'am. Good afternoon, Tikva, ma'am. We haven't started it. It will take 1 or 2 minutes. Please wait. Shall we start? It's going to be 4:10. Sir, are you ready? Shall we? Dr. Shweta, I hope you can start.
Okay, ma'am. Good evening, respected doctors, distinguished guests, and dear participants. On behalf of the organizing team, it is my pleasure to warmly welcome each one of you to today's insightful webinar titled Contemporary Homeopathy, a Dynamic Deviation. It is truly encouraging to witness such enthusiastic participation from both practitioners and students who are committed to deepening their understanding of homeopathy and exploring its evolving dimension. Before we begin today's academic session, let me take a moment to introduce the essence and vision behind the seminar titled Unveiling the Vital Mind Through the Lens of Hahnemann and Bonninghausen. This thoughtfully curated program by Hahnemann Bonninghausen Academy is designed to address one of the most intricate and often misunderstood aspects of homeopathy, the role in mind in prescribing. This two-day seminar will be held on July 11th and 12th, 2026 from 9 a.m. to 5:30 p.m. at Discovery Book Palace Private Limited, KK Nagar, Chennai. While homeopathy offers a vast ocean of knowledge on mental symptoms, disposition, and rubrics, many practitioners still face uncertainty when it comes to their practical application in day-to-day clinical practice. This seminar aims to bridge that gap by bringing together experienced and dynamic speakers who will guide us through philosophical clarity and clinical precision. From in-depth exploration of the miasmatic understanding and original proving to the practical application of Bonninghausen's method, this session promises to offer valuable insights that can be directly integrated into practice. Over the course of these 2 days, participants will not only refine their understanding of the vital mind, but also learn how to interpret and apply mental symptoms with accuracy, staying true to the classical foundation laid down by Master Hahnemann while utilizing the structured brilliance of Bonninghausen. In essence, this seminar is not just about gaining knowledge. It is about realigning our approach, sharpening our perception, and elevating our clinical confidence. Homeopathy today stands at crucial crossroad. Its time-tested classical foundation and wave of modern interpretation. While innovation and exploration are inevitable in any science, it becomes equally important to pause and critically reflect. Are these evolving approaches aligned with the fundamental principle laid down by the master? Today's session is thoughtfully designed to stimulate reflection, sharpen clarity, and encourage conscious return to the core principles wherever necessary. It is now my privilege and honor to introduce our esteemed speaker for today's session, Dr. Rangarajan sir from Davangere, Karnataka. Dr. Rangarajan sir brings with him 18 to 20 years of rich clinical practice and academic experience in their field of homeopathy. His journey reflects both depth and evolution. Until 2018, he explored multiple schools of thought, gaining a wide and critical perspective of the discipline. However, since 2019, his work has been exclusively dedicated to pure and unadulterated teaching of Dr. Samuel Hahnemann. His focus lies particularly of the profound concepts presented in chronic diseases and the precise clinical application of the antisoric remedies. His approach signifies a strong return to the classical authenticity marked by clarity in case taking, depth in miasmatic understanding, precision in remedy selection, all of which resonate deeply with the true spirit of Hahnemannian practice. Dr. Rangarajan has been an invited speaker at several reputed academic platforms, including Davangere Homeopathic Association, Shetty Homeopathy Medical College, Gulbarga, A.M. Sheikh Homeopathic Medical College. He has also contributed extensively through national level webinar where his insights have been highly appreciated by homeopaths across the country. Through his work, he continues to inspire practitioners to revisit foundational principles, refine their prescribing, and practice with confidence and authenticity. Without further ado, let us now immerse ourselves in today's session. I respectfully invite Dr. Rangarajan sir to kindly take over.
Thank you, Dr. Shweta. Okay. Are you visible? Can you hear me?
Yes, sir. Visible, sir.
Yes.
Yes, sir.
Voice clear?
Yes, sir.
Thank
Voice
you.
is clear.
Okay. Thank you, Dr. Shweta, for long introduction. Nobody gave such a long introduction to me. Introductions are always funny. Only the speaker knows whatever is said. Almost 70% is not true. Because I'll tell you a story. 2 months back, we had a 25 years reunion in our college. So our plan was to recreate everything 25 years back happened, like going to the same restaurant, going to the same places where we went, and recreating the classroom sessions. So in the part of that, they invited me, a few doctors who are doing well in homeopathy, to give a pep talk to the students. So to the college students. So I gave a little, motivating talk to the present students and MDs and internees. So I told them, I'm one of the successful homeopath who follows Organon as its base. That is the reason my practice is so successful. Okay, so everybody clap. Then we came back to the classroom recreation where Organon madam, who took Organon 25 years back, Professor Dr. Shalini Beddi ma'am, she came and took a class, Organon class. So naturally she asked first aphorism. Just I gave a good motivational speech on Organon. Every of my friends were shouting Rangarajan, Rangarajan to tell the first aphorism. But I miserably failed to tell you first aphorism. And now when I look at these flyers saying that I have a good command over Organon, I laugh at myself. Okay, anyway. I look Organon and aphorism in different way. I approach Organon entirely different way. I see the connections between the aphorisms, connections between the Hahnemannian words and sentences. I cannot remember aphorisms, page numbers, lines, time, dates, etc., which many of the good homeopaths can do. Having command on Organon is not yet achieved. I think that needs a whole life. As Lippe says, you need to study Organon, twice a year in first 50 years of your practice, then once a year. So I have my teachers here who reads Organon very passionately, dedicatedly. Like one of my teachers, Dr. Pavlan sir is here. He shared one day, in last few years, he read more than 35 times the book Organon. And still, every time when he reads, he gets the deeper understanding of Organon. So once, if you have a deeper understanding of Organon, naturally, it will enhance your understanding in practice. That will result in a great results. With this, let us start our session today, dynamic deviation. So, contemporary homeopathy. Before entering to it, I want you all to ask me some of your confusions in understanding the case and case analysis, and our difficulty in understanding patients, or difficulty in making a totality. Any questions randomly, anybody who can ask me any question in understanding the case and case analysis. We have sent a link to you all, a Google form link, where we have conducted a poll. Have anybody or everybody has participated in that poll? Can I see that one, Dr. Deepika or Dr. Okay, ask me some questions.
Good evening, sir. We have difficulty in knowing which symptoms to take and which symptoms to not include. Or is there any symptoms that need not be included? Even there is no good clarity.
Okay, good. So, in our practice, what is when we make a totality, the totality, what Hahnemann says, the meaningful totality, is it not? So, to make a meaningful totality, what is meaningful totality? Because a meaningful totality will form a true image of disease, is it not? So, how to make it that meaningful totality? Or how to understand that what we made is a meaningful totality? Because most of the time we think we have the illusion or delusion that this totality is the best totality. Okay. If you read a book called Method of Aleister Gray, he says, yeah, homeopathic success lies in the how you make totality, how big or small you make your totality. The amount of the larger or smaller of the totality depends upon the situations in front of you at that moment. So when at that moment of given time, what you make, that totality is a meaningful totality according to the situations. Thank you. This good question. Then next, anybody else? I love questions.
Sir,
Yeah, please.
Tikku ma'am has question, sir.
Okay.
How to separate acute from chronic?
Yeah, great. Hahnemann has given me a nice idea about this one. He says it is proportionately opposite. He says that completely opposite, dissimilar. But sometimes, if you see, when we see acute exacerbations and a chronic, it looks same. So the intensity decides, is it not? Yeah, I will answer that one, sure. Anything else? I always love to hear questions, but I don't like to that much to answer.
Sir, another question has been
Yeah.
by Mohini Dilip Kumar. How to treat patient with intellectual disabilities?
Intellectual disabilities. Okay. It's challenging for my intellectual ability. Sure, I will answer that. How to judge? How to judge? Yeah. Sorry. Next question I saw in it. Dr. Kirtika, ma'am. How to judge a follow-up? Wow. Great. Okay.
Sir, how to make a totality in one-sided cases when there is very few symptoms and only pathology?
How to make a totality in one-sided cases? In one-sided cases, the totality and one-sided is always opposite, because we don't have a symptom. We have like only one symptom or two symptoms, or only local physical symptom or appearance of like vitiligo. We don't have even a symptom, one single symptom, is it not? There is no totality actually. How to make? Hahnemann often says that it is the lack of understanding of the physician who thinks it is a one-sided disease. Majorly, the one-sided diseases are not one-sided. It is we, the physician, fail to understand the one-sided disease, means the complete totality. Good question then. Each one of those questions can be a full topic. True. Why I ask questions in each session is to understand, to make, just you read all these questions. These all questions came in different backgrounds in one-sided disease. You think it's about one-sided disease, about follow-ups, it's about making a totality, it is about understanding the intellectual challenged persons, you know. So from this we will start our session, because we have different issues. What all this question shows, we have different types of issues, the diversity of the issues we have. But what we are doing in the contemporary homeopathy, how these questions are answered, how these many questions, how do they think, they understand these questions? Do they really understand these questions, or do they get these questions? Or generally just they are doing a one-sided thinking, one-sided pattern? Let us see. Because as a genuine learners, we all have questions, is it not? We always seek different approaches to understand a case, because our individuality often determines the method that resonates with us. And therefore, we walk different paths according to our own nature. This is why different schools of thought are important in homeopathy. Each school offers a unique perspective and enriches our understanding of the patient through its own approach, is it not? See, for example, when I joined some of the schools of idea, my individuality was towards that one. I felt that attracted towards that idea because it is my individuality attracting towards that one. But it is just excitement. When you go into that, you will learn something or you don't learn something, that is secondary. But you have an option. especially in homeopathy, there is a scope. There can be many ideas within homeopathy, and homeopathy have the scope and inclusiveness of those ideas. That is the reason you see there are different schools of ideas are there. Because of the diversity of understandings, diversity scope is there in the homeopathic methodology, homeopathic approach, homeopathic understanding, and homeopathic philosophy. Is it not? However, the problem becomes when you follow a method with fixed ideology that limits our perception of the patient. Is it not? Every approach should serve as a tool to deepen our understanding, not as a frame into which every patient must be fitted. The danger of schools starts here. So let me start with my journey. Since 2007, I have explored, as it is said in my introduction, I have explored different schools of thought and methodologies in homeopathy. And I stayed with each school. It's not like I stayed just a few months and I left another school. No. Some of the schools I stayed almost 7 to 8 years. Some of the schools 2 to 3 years. Okay. So I don't criticize like the homeopath who never been in those schools. For example, when I was in sensation method, often I used to get criticism like if your patient comes with the a lined zebra design t-shirt and will give a sensation practitioners will give you a remedy zebra one. They used to criticize that way, but I cannot criticize like that because I was with I had a long journey with them, and I know how a sincere attempt was made to understand sensation at a deeper level. Or I stayed with in predictive homeopathy, how sincere attempt was made to understand the person or his disease in different, taking the help of genetics and other aspects of modern pathological understandings. So I don't criticize superficially because I have been there. I have seen results with those methodology. But so if I want to criticize, I need to have more authentic understanding, higher understanding from above those contemporary schools. What is that understanding? Let us see. So what are my learnings? Okay. With all these new ideas and methods, let me share with you. Be with me for some time. It may be a little bit difficult for you, but just be with me. Slowly we will understand about contemporary homeopathy and its scope and limitations and the solution for these limitations. Okay. So when I was in different schools of ideas, there was always a result. That is the reason I stayed. But the certainty of results was not achieved. That was the problem. If you ask ourselves as a practitioner, we all want results, certainty in our results. We want reproducible results, not like a sporadic result. Not like I get a result in this case and I don't get results in other case. Is it not? We want certainty. So when I was in different schools, I was getting results, but not certainty in results. It was not reproducible. Somewhere deep within me, I was not fully convinced by the philosophy. However, because I was obtaining results and was excited by these new ideas, I continued to practice in that direction. When me and my friends were, some of my friends are here who also were in different schools, like Dr. Sharan or Dr. Veda, they were here. So when we all discussed why we were going again and again into those contemporary schools of ideas and we were passionate about that one was, It is not only about the result, it is about the excited ideas that makes us to go there. Is it not? That is the big trap. If any student of homeopathy or any early practitioners, when they go into newer ideas in homeopathy, not only they are convinced about the results they show in seminars, but they get trapped in the new ideas. Is it not? Over a period of time, what happens? The truth about genuine cure gradually revealed itself to me. Because we all know I had many failures in my practice, which made me to realize what is cure. Because yeah, ideology can excite you, but unless if it is seen in your results in your practice, it will not excite you forever. What excites you should give results also. Is it not? If you are passionate about something, you are learning something, but that tool is not giving you a result, you cannot use it forever. So that is the reason I was thinking, what is happening with my cases? What is the lack in the methods I am following? And the basic understanding of homeopathy within me, what is happening to that? Am I seeing the big picture, or am I be with the flow of new ideas and excitement and not with the fundamental principles of homeopathy? This what started bothering me. My learnings and understanding in this journey was when I was influenced by particular contemporary school of thought. I approached every case through that specific idea. See, I'll tell you, as a student, if early practitioners can understand it easily, of course, the seniors also. See, if you are learning something, for example, when I was learning a mind rubric method, when a patient comes to me, I still remember I had translation of rubrics into the how the patient speak, the patient language, and rubric meaning and patient language, how he will tell, and how to interpret that one. It was almost a 1,000-page book. I used to read and read and read. This influence comes to me. The very next day, when a patient comes to you, what you will see the first thing? Whatever you got influence, you want to, whatever patient says, but what you will see what you have read, what you got influenced. Is it not? So, in that time of my practice, I was seeing, whenever the patient comes, I was seeing those rubrics. I was just want to listen that rubric, that language of the patient, which it has been taught to me. Is it not? So in another school, when I was practicing in different time zone, and a patient comes to me when I was doing predictive method, whatever he says, okay, I want to fix him into the diligent or non-diligent, a thirst or thirstless, he's an introvert or extrovert, okay, or he's speaking the language of the rubric, the mental rubrics, you know, those times of syphilitic rubric, psychosis rubric, psoric rubric, you know, I want to fix my patient's symptoms into this. Why? Because I'm already prejudiced. I have now fixed vision. I will see only this. I don't see anything else. This led me to a fixed vision of the case, prejudice in case taking and analysis. You know, Dr. Shenbara Madam asked me, which totality we should do, we should take. This, which totality, which symptom to the totality we take will be decided on how or what is in your head, which should not happen, but that's what happening, is it not? That was, at least that was happening to me. So prejudiced approach, religion or non-religion, and when we do a sensation method, we want to fix the patient. When the patient started speaking, about violence, about the jealousy, naturally you will think of animal kingdom, is it not? So when the patient speaks about the structure, when he is very particularly, specifically about the cleanliness or neatness, then naturally you will think of Mendel King. So these are the fixed ideas. You will get it. Can anybody tell me that? No, these ideas will not come to me, even though I follow this method. You can't escape. So such an approach, what it will do, it will limit your individualization, and it may prevent you from seeing the bigger picture, a true image of disease. Are you all with me, or is it going a little away, or what do you feel? Okay, thank you, sir. Okay. Thank you, at least few are with me. So naturally what happened? I was analyzing and approaching cases through a fixed vision. This led to a fixed philosophy and practice. The problem is not only your analysis or your prejudice in your cases. The bigger issue is your whole philosophy of your practice will change into the methodology of the schools and new ideas. That is the biggest damage. That is the biggest deviation. That is the biggest danger. That is the reason, if you tell this truth to someone who follows the contemporary, any school of idea, they get annoyed because their method become their philosophy, their life. Is it not? That is too dangerous. You can follow some methodology. It can become your life. But that methodology should have holistic idea. That methodology should be broader, not to have unidimensional, because it will make you unidimensional. Is it not? So there was a period in my practice, I would spend hours trying to elicit sensation and identifying kingdom ideas, even apparently simple cases. A simple case will come to me with allergic rhinitis, a clear, simple allergic rhinitis with simple dust allergy or midnight aggravations, and weakness and little respiratory issues. That will not go to my mind, because the danger is when you become a part of new idea, first thing happens to you is you will not see the simplicity of life, simplicity of case. The process of witnessing will not happen to you, because already you are stuck with something. Is it not? The first thing goes away from you is a simplicity. Simple as it is vision will really go from you. Even today, I remember like how I almost used to torture my patients. I used to take, still I remember, I used to take a case for my highest time I spent with case taking, not case analyzing. Only case taking was 5 hours. Okay. For a dandruff case, I think. Some anti-dandruff shampoo would have done better job. Of course. But see, that is the problem. Because here Your aim is to, Hahnemann clearly says, what is to be cured in the case? Which aphorism? Anybody? Any idea? Okay.
Third aphorism.
Thank you. See, he is very clear. What he says is, if you clearly perceive what is to be cured in the diseases, okay. But then what is to be cured in the diseases? Simple dandruff and some allergic. But what I was doing, 5-hour case. So why it is happening? Because, as I said, you fit the protocols. Whatever they are, we don't know. We will follow this protocol on. Let it be a dandruff. But I want to see which kingdoms it is. I want to see whether diligent or not. I want to take it, that kingpin rubric of the mind. I want to see the 26 pages of case-taking book. I want to fill. Even the patient has only one-sided disease. I want to fill that 26 pages of case-taking book, you know. So I'm not clearly perceiving what is to be cured, as said by Hahnemann. With many patients, I followed a fixed protocol. So what I was doing forcing the patients into my concepts, you know, where the concept should help me to understand the patient. Is it not? So the time and experience taught me a valuable lesson. The patient should never be forced into our concepts. Rather, our concepts must serve the patient. Is it not? Are you getting? It's like fitting the case according to a particular school of understanding is like. It's not tailored for our condition. You have to fit it. You know, we decide a shirt. We have such a shirt, and we want, you know, we often give gifts to our friends. We may not be knowing the size, but we want our friend to fit in with that color of the shirt, size of the shirt, the fabric of the shirt. Is it not? That's what we do in case taking also, in understanding also. If you have the fixed idea or fixed pattern, fixed protocol, you'll be always doing this. What is the solution for this? Hahnemann gives simple way but deeper help. What is that? So the first and foremost learning is when our minds are rooted in particular methodology, we begin to fit every case into that methodology. You know, I often see this one, especially with the students, where they followed a new method. They'll be sincerely doing this one. I really pity them because they trusted their masters or whoever taught that methodology. They are very sincere. They are wholeheartedly doing that one. They will fix this methodology to every case they see. Some cases may give results, some cases don't give results. But poor student, if they are not good successful in that method, they lose their confidence, you know. So Hahnemann repeatedly warned against such prejudice and transcendental speculation in many aphorisms, especially in which aphorism?
First aphorism footnotes.
Then this prejudice word, when you think of prejudice, unprejudice, which aphorism comes to our mind?
Sixth aphorism.
Not because the sixth aphorism speaks about prejudice and unprejudice, but we are prejudiced about the aphorism itself. Because anybody or everybody, you ask about sixth aphorism, unprejudiced observer. But the biggest error we made in the history of homeopathy by seeing the narrow part of the sixth aphorism. Sixth aphorism is bigger than life aphorism for a homeopath. The unprejudiced observer, well aware of the futility, transcendental speculation, which can receive no confirmation from experience. This is what I want to tell. See, the speculations which can receive no confirmation from experience. If you see Hahnemann, entire his life, what he was doing was, he was experimenting everything and experiencing everything, then he was putting, not speculate, not to just to have an idea, then you are applying in the case. No. He was repeatedly seeing whether it is true or not. This part of Hahnemann, the major quality of Hahnemann, is missing in contemporary homeopathy. That is the biggest deviation, I feel. What he says, he wants not only for a poor, intellectually low homeopaths like me, but he says to the powers of penetration ever so great, be his power, a most intellectual, most understandable, the great, in other translation he said witty, great witty, is it not? To those physicians also, what you have to do, note of nothing in every individual disease except the changes in the health of the body and the mind. The next thing is most important, morbid phenomena. Is it not? So he says, he notices only the deviations. The entire aphorism gives different shades and deeper understanding for me, which for me, main thing, it speaks multiple layers of things. It speaks about unprejudiced observer, the speculations. It speaks about the experience. It speaks about the intellectual of the physician. It speaks about changes in body and mind. It speaks about the morbid phenomena. It speaks about the sensed, how you perceive through the senses. And it speaks about the deviations from the healthy state, of the now diseased individual. See, that now is always important for me in every aphorism. This always I mentions. Wherever Hahnemann mentions now, it has deeper meanings. So what it means, now diseased individual, say something deeper aspect of homeopathy. We'll see what is that. Which are felt by the patient himself. And he speaks about the three sources, is it not? All these together form the true and only conceivable portrait of the disease. Only these things portray the disease, not what till now I spoke, till now what I understood, till now I was speaking about those theories and ideas, not that one. Is it not? With this about 2 words of our master, Hahnemann described, Hahnemann described every mistake I was doing in my practice. Is it? This is not only merely a simple idea in case taking, it is a holistic perspective that entirely guides you to remain within the realm of truth. This aphorism leads to most important another aspect of deviation I have observed, that is, as I said, except the changes in the health of body and of the mind, the change, the altered in the now diseased individual. I can go on speaking about this aphorism a whole day with many cases, but let us see the deviation. Altered state. The deviation is this, failing to perceive the altered and deviated state of health in the patient. You know, most of the contemporary or modern homeopathy schools, they are failed to understand this shift. Natural disease creates a fundamental mind and body. You see, there is the original state, the baseline disposition or the original state. The impact of the natural disease happens. Then it alters the disposition and state of mind and body. This alteration, this change should be observed. This is what Hahnemann speaks in. The most important, which is absolutely, without reading this aphorism, without understanding this aphorism, if you see Hahnemannian understanding one side, the entire universal contemporary homeopathy schools, maybe 100 schools, standing in the other side, seeing always the unaltered picture of disease. Is it not? So to find the remedy, what it is says, the true symbolism targets the alteration. If you see the alteration, find a remedy for the altered, not the original state. This is the true stimulum point. You are deviated if you don't see the deviation. Is it not? Contemporary method don't consider this. Deviates from this very important part of homeopathy and sees and considers whole constitutional healthy state for the prescription, selecting the remedy. Okay. So they say what they do. They see a bigger, from childhood to present day, holistic medicine, sensation medicine, genetic constitutional medicine, which is from childhood. I was recently I saw somebody presenting a case of 53-year-old person with anxiety neurosis or a simple psoriasis or something, I don't remember. So he was asking to him about his childhood when he was before 5th standard, how he was doing his homework. Was he properly doing homework without anybody saying, or somebody always should insist him to do this? How he was going to school without failing, or he used to be instructed, or he should be given chocolates or something, gifts to go to school. His psoriasis and anxiety neurosis was within 2 years of, it started since last 2 years. How the hell it is to be understood with his 6th standard homework? Good. So the contemporary deviation is the belief that single remedy should cure the entire state of the mind. See, this is another always wonder. Of course, I was doing the same thing, but when you come out of something which is, now it looks like foolishness, but I was sincerely doing it better than anybody. I think. Very sincerely I was doing. I was the most sincere student of every school I was following, very passionately doing. And now when I look at all those things, it's like, come on. If we look at our olden days when we were in love, how crazy we are. And now when we look at that present moment, how we think, how foolish we are. Because not only love is blind, even contemporary idea of homeopathy, passionate about contemporary idea of homeopathy, also blind. It's okay. So the main one more deviation, what I feel is they believe the single remedy should cure the entire state, an entire disease, every phase of his life, irrespective of challenging conditions, disease and manifestations. From childhood till now, you should see the one sensation coming through and through. What is that one thing, the rubric or one mind state, the one disposition through and through. One kingpin mental rubric, is it not? One miasm, and they want to give one remedy. That too, in a most often single dose. You should not give second dose. If I have seen, if you give a second dose of the remedy, if you repeat the dose, you are not a good one. I face those things. Second dose you given. What is the need of second dose? You should wait and watch for minimum 6 months to 1 year. I was waiting, but patient was not coming. I was ready to wait, but patient should come, is it not? Okay. The eternal weight of single dose, wait and watch. Okay. Okay, I'm done, Ranga. I'm going too much, and many of my sensation and predictive and ROH friends are with me. What they do, I don't know. This often the single one remedy for entire case or entire for life methodology is often be in the contemporary idea, where Hahnemann says different, that is different. So they often overlooks the fact that patient state may change over time, and the altered and deviated state of health must be pursued in each stage, is it not? Each stage you need to. The physician duty is not to remain loyal to a remedy. It is not our duty, always sticking on to the remedy. To change the remedy is the anxiety. We need to change, the old Kentians. Whatever happens to the patient, they don't change the remedy. They always devoted. They don't want to change the remedy. They're anxious. Even the patient state changed. Even everything has changed. But physicians don't change. They cling to the same remedy. The physician duty is not to remain loyal to a remedy, but remain faithful to the changing totality of symptom presented by the patient. Is it not? This is the flexibility. But if you're rigid, you will not live. So I love this video.
பாபமா இருக்கையே ஒரு டீயாவது சாப்பிடுறியா? ஐயோ, நான் டீ காஃபி எல்லாம் சாப்பிடவே இல்லை சார். ஏன் பழக்கம் இல்லையா? இல்ல சார், எனக்கு சக்கரை வியாதி. ஷுவரா? இது எத்தனை நாளா? ரத்தக்கொதிப்பு வந்தப்போ அதுவும் சேர்ந்து வந்துருச்சு. ரத்தக்கொதிப்பு வேற இருக்குதா? டிவி வந்த போது அதுவும் ஜாயிண்ட் ஆயிடுச்சு சார். இந்த இடம் சரியில்லை, வா நடந்துகிட்டே பேசலாம். சாரி சார், என்னால ரொம்ப தூரம் நடக்க முடியாது. ஏன்? காலில் ஆணி சார். அட பாவி, ஒரு உடம்புக்குள்ள 1 கோடி வியாதியா? சார், நீங்க ஏதோ பேசுறீங்கன்னு தெரியுது. எதுவா இருந்தாலும் இந்த பக்கம் வந்து பேசுங்க சார். ஏன்டா? மஞ்சக்காமலை வந்ததுல இருந்து இந்த பக்கத்து காதை கேட்கறதே இல்ல சார். இப்ப நான் உனக்கு என்னடா பண்ணணும்? ஒரு மருந்து, ஒரே மருந்து, அதுல என்னோட எல்லா வியாதியும் குணம் ஆகணும். எடுத்துக்கடை, இத நானே டீல் பண்ணிக்கிறேன். ஏன்டா? சாயந்தரம் 5 மணிக்கு மேல உனக்கு 2 கண்ணு அழிஞ்சு போச்சு, ஒரு காது தீஞ்சு போச்சு, கை 2 ஊஞ்சு போச்சு, நெஞ்சு டிவில காஞ்சு போச்சு, சீட்டு மூலத்துல கிழிஞ்சு போச்சு, பத்தாததுக்கு கால்ல ஆணி பாய்ஞ்சு போச்சு.
But he want one remedy.
You look sad.
Must be a patient is from the most contemporary homeopathy. I think the patient is very strong contemporary homeopathic follower who wants one remedy for him.
You have tea? Oh no, I don't drink tea or coffee, sir. Why, is it not a habit? No, sir. I have diabetes. Diabetes? How long has it been? When I got high blood pressure, that came along with it. Still have high blood pressure. When I got TB, that also joined in, sir. This place isn't right. Walk and talk. Sorry, sir. I can't walk very far. Why? There's a nail in my leg, sir. Oh, poor thing. How can one body have 1,000,000 diseases? Sir, I can tell you're saying something. Whatever it is, please come over here and talk, sir. Why? Ever since I got jaundice, I can't hear with this ear, sir. I see. So what do you want me to do for you now? Medicine. Just one medicine. With that, all my illnesses should be cured. Oh, stop it, man. I'll deal with this myself.
One medicine we want for entire this one. Okay. My friends from other schools of homeopathy at present who are looking this webinar, it's not fair, but the truth is truth, is it not? Sorry, my dear friends. You can scold me, you can abuse me later. And, you can prescribe me the right, which is my constitutional, genetic constitutional medicine. Or you can take Staphylococcus. So, state means the present state. Hahnemann never advocated for constitutional medicine. He always saw the now diseased individual. This is what I wanted to say. The now diseased individual in sixth aphorism is the main thing. Here and now is the secret. Here, now, what is in front of you, and now, what is that? That is the secret of Hahnemannian homeopathy. Okay? For example, if you all are ready, we have to search the word state in aphorisms. Just I will do it for you. Are you able to see this? See what is just we will see wherever Hahnemann mentioned or in Organon it is mentioned, the state meaning external morbid state, is it not? The alteration of the state. See, always the alteration of the state is mentioned in many places. What is meant by state? Any idea? Present condition, is it not? See, one more interesting. Okay, suppose the state, morbid state, rude state, state of health. Nowhere Hahnemann says treat a complete this one. I'll tell you when it comes to aphorisms. State of the now diseased individual, is it not? State being the organism, state of altered state of health, abnormal state, is it not? State of health, state of health, state of health, state of health. So you can do this, in your free time. You go and search this word state in Organon or chronic disease or in lesser ratings. You'll often find Hahnemann speaks about the state of the remedy, state of the patient, not a constitutional understanding of something. Even a state of mind he speaks, is it not? Morbid state. He always says the morbid state, which means the altered, changed state. Okay. So comparing contemporary models against Hahnemann, targets like time span, that 6th standard homework. No, Hahnemann says, no. Now your homework is to be at present state. The whole person, the sensation of whole, no, altered disposition of mind and body. The original state, no, altered state. To follow Hahnemann is to prescribe for the current stone, not the landscape it passes through. Is it not? You're not going to see the stone, not the landscape which passes through it. The original state is interesting, but the altered is curative, is it not? You see him, Mr. Bean, one of my favorite. Originally he looks great, but the altered is always interesting. That is to be cured, is it not? Treat the shift. This is where contemporary homeopathy completely deviates. True homeopathy aligns with the present alteration, not the past constitution. Okay. You know, these beautiful slides are from Notebook LM. It made life so easy and lazy. Okay. Let's see a simple case. You all can find the remedy. Let us go to the case. Before that, let us talk about our seminar. It's a little commercial break. Let me tell about this seminar, which is coming, next week, exactly the next week. This, can anybody share this seminar, this one? Okay, let me talk about it. First time ever in India or world of homeopathy, we are having a seminar which speaks completely about the mind in the perspective of Hahnemann. In the perspective of Hahnemann. How Hahnemann perceives the mind. How he asks us to perceive the mind. If we truly understand, rightly understand, we all have issues with the mental symptoms, how to take mental symptoms, which one to take, which one to omit, which rubric to take, which rubric should not be taken, what part of the mental is important, whether deviated mental or constitutional mental, what is disposition, what is not disposition. Hahnemann says in 200 something, the mental disposition of the mind chiefly determines the selection of the remedy. What exactly it means, is it not? There are many strategies, believe me. There are many strategies in the Organon and in chronic disease and in lesser writings where Hahnemann hints when to take this symptom, when not to take the symptom, when to consider the mind, when not to consider the mind, when to console a patient, when to give a remedy, when not to give a remedy. Just a consolation, a good talk, a good conversation, when not to give a remedy, and when to give remedy. The biggest strategy is when to use acute mental remedy, which matches the acute state, and when to give chronic, and what to do when the both are mixed. And we face this issue always, because we think mind is something it's major important, if even the case don't have it, but mind is important. The mental symptoms are so much important. Even a patient don't have a single of it. That's what we understand. That's how it's being fed to us, is it not? So what to do when we don't get mind symptoms? What to do when we get more mind symptoms? In pathological case, what to do with mental symptoms? In a one-sided disease, how to deal with mental symptoms? What kind of Materia Medica should we use? What is authentic Materia Medica? What is the authentic repertory? What is the authentic rubric to the particularly? Which rubric should be? What is the authentic rubric? Authentic source should be taken. This entire thing is discussed in these 2 days. If you attend this seminar, you will gain at least, I promise you personally, that you get everything of the mind and mental symptom, mental disease, and physical disease, how to use mentals, A to Z. I promise you. Why I promise you? Not because we are organizing it, of course, for that also, but these speakers, the 4 genuine speakers who in and out follow Hahnemannian homeopathy, who knows in and out of how to deal with mental symptoms, mental rubrics, is it not? And they are working very hard to make it authentic. That is the most important. You can attend any seminar, but authenticity is the main thing. They will give you each source from where they are talking about. Just they talk. You see something, I think this remedy, no, nothing. This is taken from this aphorism, this understanding led me to this prescription. This is how our seminars will be. The authenticity, the originality, and everything source will be given to you. Is it? So, hope if anybody is interested, anybody wants to understand the mind, don't get convinced till now what I spoke, that mind is not so important, so don't attend seminar. No, don't do that one. Mind is so much important. So please attend this seminar to understand the mind. Thank you. So the commercial break is over. We are coming back. I request organizers to give a good concession in my fees for this entire commercial break. Thank you. Let us do a simple case. You all can find the remedy. See, this is usually, okay, let me say a case. A patient of 56-year-old presented with chronic left-sided complaint and persisting pain and numbness. He had this part of almost paining, and also with numbness, constant pain. He was saying, I'll say next this one, left shoulder, left neck, left hand up to fingers. Presented continuously, constantly for last 3 months. Pain in the knee joints, sensation of weakness and problem, itching in the groin. Patient described it as a pain and numbness are present 24 hours a day. To obtain relief from the numbness, he had to keep moving the hand constantly. So what happened? How it started? 10 years back, he was sustained a sprain, like he was sleeping. He was a farmer. He slept somewhere on the stone, like supporting the stone. And since then, it started, he says. So he got allopathic treatment. What happened? Soon after he got, I think, injections, he developed a paralytic weakness of this one. He suffered for 3 months, where he cannot let the hand down. He has to keep like this. Subsequently, he recovered from the weakness from Ayurvedic treatment. So since then, this episode is there. But last 3 months, it increased, day and night. So he need to constantly move this one, intermittent pain and discomfort. Numbness became constant. He was saying continuous, this one is there. Last since 3 months, it's 24 hours, he says. That was the main part of this. So he's the patient. So usually what happens in my clinic, if the suffering is severe, even though it is chronic, the suffering is severe, or I want to see the action of the remedy, I give you a dose of the remedy. Usually I prescribe, but when I want to test such cases, they are making this is my rural clinic where I have good number of cases, and I don't have time to do LM potencies, and as I have less staff. So what I give is, I give the C potency in water dose. I always give water doses. Okay. So I give a water dose and I ask him to come back after 15 minutes. So please see this one. 26 ಮೆಡಿಸಿನ್ ತಗೊಂಡಿದ್ರಿ, ಈಗ ಎಷ್ಟು ಟೈಮು? ಈಗ 15 ದಿವಸ ಏನಾಯ್ತು? ಬಂದೇ ಇಲ್ಲ. See what he was saying. First thing is, the observation is he was not doing this one, and the second thing is, he says since he took medicine this last almost 15 minutes or so, his he did not get the numbness or the pain. He's absolutely fine, he says. Okay. He don't have pain and numbness at all, completely reduced. What to do now? How to repeat the dose? Which aphorism? Any idea? Anybody?
$246.
Exactly. Every perceptibly progressive and strikingly increased ameliorate during treatment is a condition which, as long as it lasts, completely precludes every repetition of the administration of medicine whatsoever. Okay, so usually what they do, I prescribe them the medicines for a month. From that, they will take one dose and they will wait for 15 minutes. They will report me and they will go. This is what the procedure I do. What happened? I have two clinics. So he came to another clinic where this person comes from very long. Even my rural clinic also almost 60-70 kilometers far away. This another clinic is almost 100 kilometers far away. He did not come inside. And then I asked why he is not coming. Then he referred 3 more patients of some neurological complaints. Okay. But I was so curious, always the homeopathy is always curious about, is it in our remedy, is it happening? How is it possible? We did this. Is it not? One of my patients, he did very well with diabetic. I was not so convinced with my prescription. I was repeatedly asking to him, did you do any diet? Because he was on the insulin. Within 2 or 3 months, the insulin was stopped and he reduced his dosages and he's completely well. He gained weight nearly 4 kgs and he's doing very well. I was so disappointed actually. I was asking to him, did you do any diet? How is your life last 3 months? Is it so good? Did you get any lottery? You got money or something? Because that much of improvement, you see. Homeopaths are always curious. So after 2 months, this is a different clinic. I asked him, you come here, okay? He said, I don't want to show. I don't know. And I asked, please come.
7ನೇ ತಾರೀಕು ಮಾರ್ಚ್ ಅಲ್ಲ, ಅಲ್ಲಿ ಊರು ಬಂದಿದ್ರಿ. ಅದು ಏನ್ ಕಂಪ್ಲೇಂಟ್ ಅಂತ ಬಂದಿದ್ರಿ? ಸ್ವಲ್ಪ ಹೇಳಿ ಅದ್ರ ಬಗ್ಗೆ.
ಯಾವಾಗ ಹಿಂಗೆ ಅನ್ಕೋಬೇಕಾಗ್ತದೆ.
ಈಗ ಹೆಂಗಿದೆ ಅದು?
ಈಗ ಉತ್ತಮ ಸರ್.
ಹೆಂಗೆ, ಎಷ್ಟು ಉತ್ತಮ?
80% ಉತ್ತಮ.
80% ಉತ್ತಮನಾ? ಈಗೇನ್ ತೊಂದ್ರೆ ಈಗ ಸದ್ಯ?
So he said he's 80% better, all those things. Then I asked him, okay, what you did with that 3 more packets? Because I gave him 4 packets. So he don't want to use that 3 packets. So he don't want to come for a follow-up. So it is there, so I don't want this. What are those 4 packets? 1 he took, 3 is remaining. So the remedy, any idea? Simple remedy, no need of, my prescriptions are very simple. Since I came back to Hahnemannian homeopathy, before my prescriptions were very complicated. Causticum, okay, sir. Any other guess? Saran sir, I told you this case, so you are saying, I know. Arnica. Okay. We'll see this. Pain in the muscle of left shoulder and arm, also in bones of arm while joints remain unaffected. Strain of left shoulder joint very painful for a long time, became at last immovable, sleepless at night. Violent tearing pain in the arm, most violent, while lying still. The arm upon which he rests head in sleep becomes numb, shooting pains through arms, drawing paralyzed sensation in left arm at night, sticking, drawing left arm extend downward to the tips of fingers. That was coming to him. Numbness or aching in left arm with heart disease. That was not the case, but it is there in the heading. Rheumatic pain. Pains, aching, drawing with numbness begin in the right hand, extend to all parts, stiff in the morning, beginning to move, must change position frequently to cause of pain, was after midnight. The 4 packets and $250 of my fees. Usually I give LM potency, but here Rastax 30, single dose. If you see upside, that is first packet was given 4 pills, then 30, which was remaining with him. Another is placebos. So he came at the 28th March, and that was this one we saw. Itching in groins, upper extremities pain, numbness, 80% better, knee joint pain when he only exert himself, sleep better. He stopped that adike and delay, this means nuts. He was having that one for a longer time. That also he stopped. So this is the story, So the LM potencies I usually give, 2 pills I give, 2 spoonsful. The patient was asked to wait for 15 minutes. The intention was to observe whether the remedy had begun to act and whether any immediate change occurred in the patient's suffering. This type of cases offer an excellent opportunity to study the action of medicine directly before our eyes. So usually before I used to do this one, every acute marked improvements I used to record because I used to present many cases in the seminars and monthly meetings. Nowadays I don't do that one, which I should do. 2 reasons to show this case. The second reason being to show the efficacy of not complicating the approach. Being at this moment, clearly perceiving what is to be cured at this moment. It's very simple, he was doing this one and he had a sprain which started from a pain, a wrong movement, usually. The numbness which travels. So this is a simple case of Rastax. So what is the main thing? If suppose the same case, imagine, came to me some 7-8 years back or 10 years back, think of him. How I would have complicated the case. Tell me more about that numbness. Have you done your homework at the 5th standard? No, sir, I did not go to school. Oh, how to ask now? How to deal with the patients who don't go to schools? Okay. So seeing the big picture, always see the big picture. Let's do a long case, but I will do it very fast as we have only 3 minutes left. My friends always says I don't finish it on the time, so I will do it today. 3 minutes case. Can one, okay, I will do this one, okay. So this case of multi-layered case, I will tell you very simply, he had these many complaints. You see, it is like, these are his complaints. Imagine left-sided paralytic weakness, diabetic vertigo, intermittent fever occurring every year. That Balaji joke, all the million disease in one person. Maybe he is that person. The nasal blockage, twice he did deviated syndrome, respiratory issues, alopecia areata, he was taking treatment, ointment, something for that, gastric complaint, constipation, right knee joint pain. Only these are the complaints. The methodology I was doing, as you all know, before this one, I was doing. So he was taking metformin. Even I was using different approaches. Still, I could not able to reduce his metformin and his inhalers. And he was getting every month of February and March, he was getting this one. So I took this case in 2020. And I constructed
Sir,
a complete.
excuse me. Please switch on slideshow.
Ma'am, slideshow தெரியுது ma'am எனக்கு.
Okay.
Sir, you continue, sir. All clear.
Seeing the true picture, a true image of the PPT. Okay. See now I am showing PPT. Madam is not able to see. It's not about the mistake of my network. It is about us. The same way we are prejudiced about homeopathy. It's not about the patient who is not coordinating the true image. We are not able to see that one.
Sir, actually, ma'am was telling that you can give the full screen option. Sir.
Allow me this joke here. You don't show it sincerely. Let me have it.
Okay.
Okay, now it is visible or not visible?
Sir, it
Sir,
is
actually the
visible, sir,
screen
but
is
it's
visible, sir.
Okay.
The complete full screen.
We can then.
Can you give F5, sir? I think F5 should look right.
So you have to stop screen sharing and then share the full screen.
I'll do that. Is it visible now? It is visible in my another computer.
Sir, it is visible, sir, but can you make it full screen? Like your the side of slides are also visible. So,
Understood.
Yeah, no, it's perfect.
I am not showing the complete picture, is it not? I was showing
Perfect,
the
sir. Yes.
I was showing the part. Some patients do that one. They hide the true picture of disease. No, it's not the physician mistake, it's the patient mistake. So the realization happens to me on certain point. The realization is not happened smoothly. It was kicked because of my many failed cases. So I constructed a complete timeline of the case, studied the present symptom, present state carefully, started treating the patient according to strict Hahnemannian principles, state by state. The paralytic weakness gradually improved within few months. The nasal obstruction improved. Diabetic showed improvement. Respiratory compliance became less troublesome. Don't ask me which layer of suppression, please. I don't know. The patient brother died of acute leukemia. That was the big emotional shock for him. Again, all symptoms were aggravated. So here I confirmed this one. After this grief, he was giving, his state was aggravated because Hahnemann says that one Sora affects the sadness and vexation, affects and it increases the what you can say, it increases the intensity of Sora and it brings out this secondary soric symptoms. So after this, I was getting a clear-cut soric symptoms after the aggravation. So I started with anti-soric treatment. Slowly, the pattern of reversal happened, traveling backward through its history. Stopping at each stage, it was producing the old symptoms. Every place the symptom was coming, I was mentioning that one. Usually I keep ROS, return of old symptom. Then the case goes further. The another set of symptoms goes, another set of comes. So in 2022, what happened was his no, just a minute. Okay. Yeah. So he's almost all metabolic respiratory breakthroughs. The medications completely stopped him. The respiratory medicines was discontinued. The blood sugar levels was from 13 to this one, HbA1c, started gradually coming. Then the main symptom of that hay fever-like state, it was managed with China. That is the time the eruption suddenly appeared in the left forearm, which he said he suppressed that one 16 years back. It was like wonderful for me to see the return of old symptom beautifully coming back. It's like, I always use this example. If you are started from disease, health to disease, you should go back to the healthy state. The same stops, like a train coming from Bangalore to Chennai, it stops in different stations, is it not? When the train goes back, it stops in the same stations, is it not? So the return of the journey, the return of old symptoms will rightly indicate you. The Hahnemann rightly says the indication of recovery, one of the recovery is the return of old symptoms, is it not? It beautifully come into this case. That is the reason I am presenting, not because of this. I'm not going to tell about the remedies because I give many remedies at a time, at one time. Sorry, one time, one remedy. That is the time. What happened? Every return of almost all symptoms came back. It went up to the 7th, his childhood. That time he has had some tonsillitis or gums issue. He used to get gum bleedings and all. That symptoms came back. Okay. Then he got eruptions on his hands. Many of my friends knows this case. I was struggling with that case during that time. So he had this severe eruption in the sense, not eruption, the pustules, filled with discharge. White discharge, why not liquid water discharge? Then that is the time he was not saying many symptoms to me. Means he hidden many things. Then I came to know that he had impure poison, and I started with treatment for that. Then after that, the case started again further improving this one. So at one time of the case, I was stuck in the case with I was giving indicated sulfur, and in sometimes when the indication changed, I was giving with Merxol, but the case was not improving. I came to know it is complicated with syphilis and SORA, but the case was not improving. That is the time I referred chronic disease. Sorry, the source I did not keep. I will keep the source later. Page number and everything. Hahnemann says when this kind of condition, it is complicated, when the original symptoms of SORA comes about, you need to give very high potency. That is the only time he says to give high dose. Then I changed shift to Merxol 3, then the case solved. The current health status is paralytic weakness has completely disappeared, no respiratory and postprandial 6 to 7 becomes. The main thing is he referred me more than 300 patients. Really, I'm saying. I said to many my friends, he's the angel patient of me. Not because of this condition is improving. When he was improving in the midway, I'm saying 2 to 3 years back, he referred because he's a politician. Whoever he goes, whoever he says, there is one doctor, you go and meet him. He does good, or homeopathy is good. He's a good promoter of homeopathy. He imagined when he referred almost 300 patients to me before he got bedridden with their eruptions and all. Imagine about my condition, my situation. All those patients comes to my clinic, and in bed, the entrance only I had a bed, this one card, where patients used to lie down or I used to examine. There he'll be lying like this, with the hand and legs, with this one. And he got emaciated also. And those patients who comes regular to me, Also, friends of them, they were doubting me like anything. Fortunately, he came back, and again the different promotion happened to me. Okay. So what is the clinical takeaways? Modern chronic cases are multi-layered. We see such cases. We don't see a case come with only gastritis and we give Naxomica, the patient is much better. He lived happily after that. No, is it not? There are multiple layers, multiple conditions of the cases. So we need a approach which has, I'll go fast, which is multi-dimensional, not a hammer nail theory. Like if you have his hammer, everything begins to look like a nail. No. Okay. Is it visible now?
Yes, sir. Yes, sir.
So can one remedy solve this case? No, is it not? The two cases we saw now. One case we saw a simple case where everybody can give Rustax and we give. What is happening means we see those cases in the seminars and the webinars, like how I did. And a junior or a practitioner or students think that is the easy way to attain the cure, or it is easy to have such cases in our practice. But the reality is we see such a complicated cases. The real learning is in the complicated, detailed cases. See, this case, I have minimum follow-up of 4 to 5 years in different time zones. Where I changed, why I changed, what is the aphorism, helped me to change the remedy or change a potency or change the dose. See, these kinds of studies should be encouraged in homeopathy rather than giving a magical cures. Magical, where I said the patient came and he referred 3 cases. And what about, no, he's a very recent case. What about further? I did not give him latent Sora symptoms. I did not take the Rustax case, I'm saying. But what I did, I'm showing in front of you all and boosting my ego. That is where the contemporary homeopathic seminars are happening everywhere. They give you, the student sees that one, he gets impressed. But when he applies into his clinic, that is not happening. Because that is not the reality of. Because I treat hundreds of cases per month in my clinic. I get miraculous cases, very 10. That 10, I take and put into a PPT and I show you what about another 990 cases where still I'm struggling, where I need to apply different approaches, where I need to refer always Organon, chronic disease, I should discuss with my seniors and friends. This is the reality of our clinic. So imposing ourselves as a great prescribers and doing something great, we always should teach to the students and early practitioners how to deal complicated cases. That's what I would like to conclude with this. So we need multi-dimensional approach. Hahnemann spoke, see, for example, we see Hahnemann spoke alternative disease, intermittent disease, local middle disease, one-sided, physical, epidemic, sporadic, miasmatic, so and so. Tell me one contemporary homeopathic school which speaks about the diversity of diseases, the conditions we face. They see only one thing, find the one remedy in the case, and everything is fine. Is it the truth? No. So we need to, however, everyone can understand the organ of medicine. See, one school of idea, the book is there. I cannot understand. I can understand. My fellow homeopath who is in different school, he cannot understand. But every homeopath, every contemporary homeopathy can understand organ of medicine, which is common, rooted, principle based, not on the ideas based book. So we should encourage that one. When everything, the hammer and nail concept, if you see, if you all have is a hammer, then everything looks, it is like you have a cricket team with full of batters. When you approaches of mental rubrics or sensation or you have one approach, you need one thing, or you have a football team full of goalkeepers. Is it not? So you'll be very confident. I have all the, goalkeepers. Is it? This reminds me in cricket. Who is the best finisher of the game in cricket? I think cricket fans knows.
Dhoni, sir. Dhoni.
See, the recent match in IPL, Vaibhav Suryavanshi, the new protege, is a new person who, very young boy, beating everywhere. See, in this last match, he beaten 96. But what is the result? Anybody can start a match, but who can end? Who can complete the match? Here, our contemporary homeopathy fails because they see, their concept is that they see a case, they see a disease, they remove the disease, or they give good results. For example, H1C came before and after they show. But what about complete the cure? The concept of completing cure. You start well, but how to finish the game? You need to finish the game. This shows another deviation of contemporary homeopathy, that is unfinished games. The theory of chronic disease says, so lack of knowledge in chronic diseases, lack of knowledge about antipsoric treatments leaves the game unfinished. You see, you think the patient is cured, but it comes back. That is the thing was bothering Hahnemann. The recurrence of the complaint or the complaints is becoming more and more, is it not? So this strategy, he discovered a strategy where we need to complete the cure with the antipsoric. Imagine, without knowing this, we present a case. I have presented many cases. I got good claps. But later, after the 3 or 4 years, the patients were coming with the different disease with, or the same disease increased, or different disease multi-layered. So we need to finish. To finish, who is the better person? So to finish the game, you need, what do you need?
We need Dhoni, sir.
We need Dhoni. No. Here, Dhoni is not important. The hidden.
Dhoni Hassan.
Antisoric remedies, sir.
Antisoric drug.
No. I am saying something, not Dhoni. What is remaining? What helps you finish, complete the cure? Any idea? 7 for the reason.
7 cardinal principles, sir.
Color for the reason. See the 7, which I mean to say, is it not? You need 7 to finish the game. So if you are strong on the 7 cardinal principles, you can finish the game. So when you have not the nail hammer theory concept, but if you have the Hahnemannian holistic tool set, it is multidimensional, and you have, according to your case, you will use a different tool to use. You may need sometimes asoric remedies, you may need antisoric remedies, you may need intercurrent remedies, you may need many strategies you can build, but your tool should be multidimensional. If you have only hammer, you'll see the nail, but if you have a multidimensional tool, you can tackle many such conditions. Hahnemann's approach, Hahnemann's concepts and understanding, the principles are multidimensional. Is it not? multidimensional tailor-made approach. Now this is truly tailored for you, is it not? Principle fits the person or the student. History teaches that the spread and growth of homeopathy largely depend on how consistently its adherents fundamental principle of homeopathy, the strict inductive method of Hahnemann, characterized by pure experimentation and exact observation, has today been replaced by dream provers, group provings, delusionists, sensationalists, essentialists, kingdomalists, etc., who feel the need to explore new and for them better avenues, likely because the well-established and well-proven but poorly applied are greatly ignored or misunderstood fundamental principles and rules of homeopathy have failed them. Is it not? Andrew Saini, it's one of a good book. So please follow Hahnemann. Thank you. Thanks for your attention. If you have any question, please ask your teacher, not me. Thank you. Thank you so much. Thank you. Thank you. Thank you. Thank you. Please post your question here. Don't post. I will ask questions, but I don't answer. Thank you. Thank you. Thank you. Sorry, my dear friends of different schools. I know you will abuse me, you will scold me. Today also I did not finish on time. But I am doing better than...
Sir, you're very better, sir, today.
Because I know, I remember 1 hour webinar I took for 4 hours. But my friends and participants are so compassionate on me. Thanks, Shubhla. Thanks a lot. Anything to say or anything to conclude? Anything anybody wants to ask me something or scold me or you want to prescribe me Beretta cup or tell me the potential? So say anything. Any commands? Pavalan sir, thank you sir. Excellent presentation with experience of each school. Few only achieve this. The return back to master, you have done it excellently and we can feel it. Hence, it is your experience. Thank you so much for the insight. Thank you, sir. I don't know. I have insight or not, but I have short sight. So I did. Thanks for your kind words, sir. But my awareness is this much. Thank you, sir. Thank you. Like you teachers are bringing back the deviated students who we were like. We were many practitioners and students who got deviated, and we are coming back to the roots. It's really soul satisfying journey. Does the feeling of constantly wondering whether or not you are prescribing it properly to patients ever and reduce? Asking me, or okay, is a self question? Okay. Or is that a feeling we will carry throughout our practice? Yeah, you should carry. This is a wonderful feeling, though it is, yeah. It it hurts you. It always hurts you, but carry this pain, you know, because the homeopathic aggravation is always good. The extra remedy, the extra dose always give you the aggravation, but that is the indication of cure, is it not? So always carry this the whole life, you know. That is the reason Hahnemann was experimenting and experimenting, because constantly I feel guilty, and constantly I feel whether am I good, am I doing better, my prescriptions are really good, am I doing my job properly? You know, often in my practice I feel that I don't know anything. I go into like kind of depressions, the depressional episodes, you know, because I feel that I'm not doing genuinely, I'm not doing proper service to homeopathy. That always bothers me, but that makes me a better homeopath always. I'm not humble enough, but I really am saying I'm a very genuine homeopath, because not because of the results what I'm giving, but because of the constant feeling, the lacking feeling, make me a better homeopath. Not because of I have good knowledge, but I lack knowledge, I lack understanding. But the opposite part is I go into Organon, I go into refer master works. What makes me to do that one? The feeling of that lacking, what you are saying. So it is good to have that constant struggle. Only a deviated man after coming to right path can guide in better and effective way. You are doing the same, sir. Keep moving. Thank you, Saran, sir. We know you are one of my co-partner, co-traveler who did suggestion method. Dr. Sharan and me went to various schools, spent lakhs of together money, and he gave seminars in different platforms. I gave seminars in different platforms. Now we are back to now Dr. Sharan is one of the great homeopathy in Gulbarga in Karnataka who does Hahnemannian homeopathy following LM potency. He is the first person to introduce Hahnemann homeopathy in Gulbarga state. I witnessed all the fun and cry at the same time, sir. Yeah, true, that is true. Thank you, sir. Thank you. So anything to say, or we conclude? Organizers, tell me something good about me and we'll finish, because you start something good note about me. I liked it very much. Very less often I hear good things about me, and you are the only persons who tells me good things about me, reads my notes, whichever I gave to you. Thanks a lot.
Thank you very much, sir, for your deeply inciting and thought-provoking session. Your clarity is addressing the deviation in contemporary practice, and your emphasis on returning the essence of Hahnemannian principles has given us much to reflect upon and integrate into our practice. As we come to the close of today's session, one message stands out clearly. True mastery in homeopathy lies not in complexity, but in clarity and fidelity to principles. Today's webinar has certainly helped us realign our perspectives and reinforce the importance of the classical foundation in our day-to-day clinical practice. On behalf of the organizing team, I extend my heartfelt gratitude to Dr. Rangarajan sir for generously sharing his knowledge and insights with us. I would also like to sincerely thank all the participants for our active engagement and enthusiastic participation. We look forward to your continued association with us in future about the academic sessions. Thank you once again, sir. Wishing you all a wonderful evening and continued success in your homeopathic journey. Thank you.
Thanks a lot. Though you said less good things a lot.